Let's start by exploring two major autoimmune disorders: systemic lupus erythematosus (SLE) and rheumatoid arthritis (RA). SLE is a complex systemic autoimmune disease that can affect multiple organs, often presenting with joint swelling, pain, and characteristic facial rashes. When diagnosing SLE, the anti-Smith anti-SM antibody test is the most specific, as it is found almost exclusively in SLE patients. In contrast, rheumatoid arthritis is also an autoimmune disease, but is distinguished from osteoarthritis by its systemic inflammatory nature. RA typically causes prolonged morning stiffness, joint pain, and can lead to joint deformities like swan neck. Osteoarthritis, on the other hand, is a non-inflammatory degenerative joint disease, often associated with crepitus and worsens with movement. Understanding these differences is crucial for accurate diagnosis and effective patient care. Burn injuries and skin assessments are vital topics in nursing care. When evaluating burns, it's important to distinguish between different depths. Superficial burns are red and tender, partial thickness burns present with blisters and pain, while full thickness burns appear dry, pale, and are often painless due to nerve damage. For example, a patient with dry, hard, pale skin and no pain likely has a full thickness burn. Skin assessments also involve identifying lesions. Terms like wheal, papule, and plaque describe specific appearances. Nurses should document distribution patterns such as symmetric or zoster and recognize warning signs like petechiae, which may indicate serious underlying conditions. Proper wound care, infection prevention, and patient education on sun protection are all integral to optimal outcomes. Neurological emergencies require rapid assessment and decisive action. For patients experiencing seizures, the nurse's first priority is to assess for injury, especially head trauma, before documenting or notifying the provider. In cases of head injury, signs like a sudden change in consciousness, severe headache, or abnormal vital signs must be reported immediately. Monitoring intracranial pressure (ICP) is critical. Normal ICP ranges from 5 to 15 Hg. Calculating cerebral perfusion pressure (CPP) helps determine if the brain is receiving adequate blood flow. For spinal cord injuries, the return of spastic movements signals the end of spinal shock. Always maintain cervical spine precautions in trauma cases. These priorities ensure patient safety and guide timely interventions in critical neurological situations. Effective nursing care extends beyond acute management to include patient education and prevention strategies. For chronic conditions like SLE, teaching should cover the disease process, medication adherence, stress management, and pregnancy counseling. In burn care, monitoring urine output is the best indicator of adequate fluid resuscitation. For patients with casts or mobility aids, proper use and infection prevention are essential. Remind patients to keep casts dry and move joints above and below the cast. When teaching about sun protection, recommend broad-spectrum sunscreens with SPF 30 or higher and advise avoiding sun exposure during peak hours. Empowering patients with knowledge helps prevent complications and supports long-term health.